do I change?
Oh, there's a mouse right there, sorry. The keyboard is, here's the keyboard, so let's just. There we go. And we have asked to raise the heat in the room. I'm too close to it. Just like 5.
Okay, and then just down. Okay.
There we go. Down, right.
Okay,
Left.
got it. Okay. So I just want to say thanks for having me at this workshop. I think it's a cool opportunity for PhD students to also be involved, because I think oftentimes in workshops, students don't get the opportunity to come along, so thanks. I'm in the first year of my PhD program at SFU in the city's Health and Active Transportation Research Lab that's led by Megan Winters. And in 2016, I started working on our CIHR-funded study of Vancouver's public bike share program. And I worked on that for my master's, so I'll be sharing some insight into the methods that we use to understand bike share in Vancouver, as well as our high-level findings from this study. And most of what I'm sharing is from Vancouver, but we've also done a bit of work in other cities, which I'll be touching on. So since Vancouver's public bike share program, Mobi by Shago, launched in 2016, there's been 1.7 million trips and 4.7 million kilometers traveled and over 500,000 hours of cycling on these bikes. And to give you some context, I think Vancouver is pretty happy with how their bike share program is doing, but this is the number of trips over a 3-year period, and in Montreal, over 2 months, I think in July and August, they had over 2 million trips on their bike share program. So ours is still relatively small compared to theirs. So when we're thinking about equity, some of the questions that we're interested in are who are making these trips and how often, what types of neighborhoods are served by this program, who is excluded from using bike share, and what are the barriers to using the program. So to try and answer some of these questions, Megan and the research team has employed several different methods. And I don't think it was intended to be a 7-year study, but Vancouver's bike share program was supposed to launch in 2013, so that's why Megan did her baseline data collection in 2012, but it didn't end up launching until 2016. So I think that's one lesson to doing research in this area, is that it's very fluid and hard to plan for in the research world. So yeah, we've done population surveys, member surveys, spatial analyses, and so on. And I hope through my presentation you'll understand the need for all of these different types of methods to understand equity. And I'll be highlighting methods from these, or findings from these different research activities. So when I think about equity, I think of the spatial component and the social component. The spatial component being where are these services and do people have physical access to them? Yesterday I learned that maybe the terms you use are equity of access and equity and outcomes. I think this is similar to maybe social and spatial. Social being, okay, so maybe you have access, but are you actually using it, and who benefits from these programs? So I'll be starting with spatial equity. So back in 2017, we were interested in understanding who had spatial access to bike share programs in Canada. So at the time, there was just 5 bike share programs. And we used the Pampelon Deprivation Index, which is an area-level measure of socioeconomic status, and assigned dissemination areas, DAs, to one of 5 deprivation quintiles based on a number that DA was assigned. And so in each of these cities, there's an equal number of dissemination areas that are in one of 5 categories, the lighter yellow being neighborhoods that are least deprived, so have a higher socioeconomic status, and the darker brown areas being neighborhoods that have a lower or most deprived or have a lower socioeconomic status. And then we mapped where the bike share programs were, which was defined as 500 meters within a bike share docking station. And we looked at the types of neighborhoods that were inside the bike share service areas and calculated the proportion that were in each of these deprivation quintiles. So since there's an equal number of DAs in each city, if the bike share was equitably distributed across deprivation quintiles, we'd expect this pie chart to be 20% in each. And so this is what we found. I think Montreal and Toronto and Hamilton were all actually doing reasonably well. Vancouver and Ottawa-Gatineau, less so. In 4 of the 5, the neighborhoods in the least deprived, so higher socioeconomic status areas, were the most served. Interestingly, in Hamilton, it was the opposite. I think this is largely the way that cities are designed. In Hamilton, their downtown core is typically lower socioeconomic status, so it's easier for maybe a bike share program when they're considering other things like population density, employment centers. They were able to put it also maybe in the area that was serving lower income people. Yeah, but this was in 2017, and I think since bike share programs have expanded, and we showed this to Vancouver back then, and I think they weren't surprised, but it did make them think about it, and they have since expanded eastwards in Vancouver, which is a somewhat lower socioeconomic status area, and they could have gone west, which would have also been a reasonable area, but they decided for phase 2 to go this way, and that has made a difference. Okay, so social equity. So given what we know about spatial equity in Vancouver, I think it won't be surprising some of the things we see in social equity, and it's actually a lot of similar trends that I think we're seeing in ride-hailing as well. So using our member survey and population survey, we looked at who's a typical member of the program. So a typical member is Canadian-born and Caucasian, highly educated, working, higher income. They live downtown. They're younger and live and work near a bike share station. So I think none of this is surprising and pretty similar to what we see in a lot of other cities. But what was interesting is that this is who's a member, not necessarily how much they rely on it. When we looked at system data, something interesting that we found was that 10% of members make 50% of member trips. So there's a small minority of members who are actually taking advantage of this program. And this is meant to show you that here 10% of members are making 50% of trips, and something like 50% of members are making 6% of trips. So we wanted to know who are these super users of bike share, who's actually gaining the benefits of bike share. And what we found was different. Well, some things were similar. A super user of bike share compared to a typical member is more likely to be younger, I think in their 30s, 25 to 30. But they're more likely to be in the lower income category than the higher income, and to have been outside of Canada. So those were different than the typical member. And they're less likely to own a car or belong to a car share program, indicating that maybe people who rely on bike share are more dependent on it because they don't have access to other means of transportation. So I think this was kind of an interesting finding, that we shouldn't just look at who's a member, but also like how much do they use it. Okay. Also interestingly is we ask a question in our population survey, so this is people who use it and don't use it. What are the barriers to using bike share? And this one was about cost. And what you'd expect is maybe lower income people to identify cost more commonly as a barrier, but in fact what we found is that higher income residents in the 200,000 plus annual household income were more likely to indicate cost as a barrier to bike share use than people in the lowest income category, which was less than 20,000. So that seems kind of counterintuitive, but we also did focus groups, and this also actually, I was sitting in on the focus groups, and this kind of came out in the focus groups as well. So there was one that we did that was with a group of women with low incomes. And cost did come up, but not as much as it did in some of the other options. And for one of the women, she said, the $20 a month sounds pretty good. I can't even get everybody in my family a bus pass. And I think what this highlighted for me is that so for many people, maybe you have the transit pass, and if you're gonna get an additional bike share, it's expensive. But if a bus pass isn't an option, then bike share is actually pretty reasonable. But they did identify other barriers to cost to using it. So this included time restrictions and overage fees. Overage fees are pretty expensive in Vancouver, so I think that's a real concern, that if I don't get my bike back, I'm going to be charged, I think, like $5 for every 15 minutes. No options for kids, so these were all women who had children, and there's no bike share bikes for younger or smaller sizes. For a lot of them, they're walking to get their groceries, and there's a small basket that you can use, but it's not really big enough to transport your groceries. And also a lack of awareness about how to purchase a program. For many of them, this is the first time they were really hearing about it, even though they had seen the bike share programs. A lot of them didn't have internet access, or just hadn't heard about it, or didn't know how they would even go about signing up for it. Vancouver's bike share program has introduced the Vancity Pass, so this just gets at the income barrier. It was a pilot that started in 2018, and it was I think it's an annual pass of $20 for people who qualify through different ways, but mainly getting at lower income people. One thing that was really good is from our focus groups, I think they really identified that 30 minutes seemed too short for them, and what they ended up doing with this Vancity Pass was making it the longer time restriction, so they had 60 minutes on the bike share, which was good. And this has been a fairly successful program. They've decided to continue the pilot and make it a part of the program going forward. And I think there's been something like 45,000 trips made on the Vancity Pass so far. So the last equity angle that I'll talk about today is about the cycling, or bike share and the gender gap. So bike share was once proposed as a solution to narrowing the cycling gender gap. So in cycling, there's a very well-known gender gap between men and women. I think women generally make about a quarter to a third of trips that men do on bikes. So back in 2013, this is an article that was published in City Lab about that was based on a study about how bike share might be key to closing this gap. And I think some of the rationale for this was that women are there's a relatively high proportion of women who are members of bike share programs, like 40%, which is higher than maybe the cycling participation rate overall. Also, I think there's a thought that bike share might start to normalize cycling in a city because people might be wearing more regular clothes rather than spandex. But we are interested in looking at whether this actually played out. So in the States, some of the programs have included basic demographic data in their bike share system trip data, and it says whether the trip was made by a man or a woman. So this is from 3 of the largest programs in the US, New York, Chicago, and Boston, I think. So we looked at the number of the trips that have been made over the past 5 years in each of these programs, and then we just calculated how many were made by men and women. And what we found is that overall, about a quarter of trips are made by women in each of these cities. And there's actually been, I hypothesized that this gender gap would narrow over time, but it really hasn't. In New York, it did a little bit. It went from about 22.5% of trips made by women in 2014 to 25% in 2018. So there is some movement in New York, but it's just catching up to where the other programs are. So I think this highlights that new and emerging shared and mobility technologies are not necessarily serving the needs of women, and that there needs to be more research in this area. I don't actually have the answers to these questions, but I think probably having more women in transportation research and who are operating these programs is probably a good place to start. So other equity considerations in bike share that often come up that we didn't consider so much in our research, but I think in the States and other places are considered. So who is shared mobility for? In Vancouver, I think we have mixed messages. So initially they said bike share is only for locals because there is a lot of contention between the bike share rental shops and the city. But then they put bike share stations in Stanley Park. So I think they're kind of trying to get, and maybe shared mobility can be for both, but there are examples of programs in Barcelona and places in France where only locals can use bike share, and you can't even use it as a tourist. And so it's very clear in their programs that we're designing this program for locals and not tourists. Accessibility for people with disabilities, I don't think is talked so much in bike sharing in Canada. There are a few programs in the States where they've started to look into different pilot options for having accessible bikes. I think there's still challenges with these because they're not widely distributed throughout the program, but this is an area. And then equity in hiring and operations, which I haven't really heard a lot talked about for Canadian programs, but in the US I think is something that's considered more. So my main takeaways are that bike share is heavily used by a small percentage of users. So when we're looking at how many trips are being made, it's really by a small proportion. There's still a long way to ensure equitable access to bike sharing, but I think efforts are underway, and the conversations around equity are happening much sooner in bike sharing than they maybe happened when the car or other modes of transportation have been rolled out, so I think that's positive. And mixed methods approaches are essential for understanding the different dimensions of equity in bike sharing. I think the system data that we always want offers us some answers, but we still need to do the traditional research methods of talking to people through focus groups and doing surveys to understand why or why not people are using this system and whether it benefits them. Thank you.